Let's talk about meeting people where they're at. When it comes to things that should be done, but somebody cannot afford to have done, like let's say your old dog has a heart murmur and needs a dental, and they can barely afford the dental, barely afford the extractions. The dog clearly needs a heart workup, a chest x-ray, a blood pressure, and labs before being sedated for this dental. That's obviously what would be best case scenario. The cost is so astronomical to the client that it is not possible. Do you sedate the dog and do the dental with the risks, knowing in full informed consent by the owner, in order to try to help that pet at a lower cost, but not the quality of medicine that you would ideally like to practice? If you're a veterinarian, I want to know, will or won't you? And if you're a client, how do you feel about this circumstance and these kind of things that happen? Because veterinarians are constantly in the battle of needing to do the right thing legally, medically, protecting our license, offering all the things. But I fall in the category that as long as it's informed consent, the client has and should be able to decline things in order for us to try to help the pet within their budget. I will still perform surgeries. I will still do dentals. I will still do pain meds and heart meds and anti-inflammatory meds, all without required blood work or required things. They may, yes, have to have an annual exam. They have to be an established patient. They have to have a veterinary client-patient relationship. But as long as they know and the client understands the risk to their pet by not performing these things to the highest level, the gold standard, the ivory tower method, if somebody cannot afford it, I think we should still do right by that pet and still help them. Now, I know every clinic runs differently and everyone has different rules and policies. I am not harping on clinics that have strict policies about these certain things. Everyone has to do what makes sense to their clinic and their practice and their area with the doctors, what they feel comfortable doing. Everybody has their own rules. That's the perk of being your own boss. But I think it is an important discussion because we have to realize that that is a variation and a variability that is occurring across practices, corporate or private or otherwise. And for clients, it is confusing to know when things is a rule or when something is a rule versus something is a preference versus something is a hospital policy versus a law. And I think it's just so hard for clients right now with the cost of things and healthcare being so expensive. And I'm trying to battle that from just getting so out of control, combating against private equity takeovers, insurance, corporate medicine. But I think we have to acknowledge that sometimes helping the pet might mean not doing it the exact right way.